Interestingly, in terms of the burden of world disease, oral disease is the top. Might not be life-threatening, however, its consequence is significant for so many people.
We're trying to establish what interventions are effective for treating oral diseases and disorders and which interventions aren't effective.
The Cochrane review goes through a very systematic way of analyzing what the literature is and what the literature can give us.
It was very rigorous, and there's a standard format, and it has its own software, Revan, which makes it very convenient as well.
As a clinician, it's very easier to understand what it is, what are the different studies, and we can take those things and apply in our practice as well.
The Cochrane Oral Health Group's an international collaboration of clinicians, researchers, statisticians, consumers, all working together to develop systematic reviews that look at the best available evidence to inform clinical decision making. So we're looking to see what interventions are effective and what aren't.
We support author teams around the world. There are around 1,200 members from 40 countries, and we have 800 authors that we have worked with.
People from less developed countries and people from more developed countries, we try and put them together to give a kind of an international perspective.
I'd say that the most of our evidence would be for general practitioners.
In order to stay up to date, to base clinicians' decisions on the best evidence, they would have to read an overwhelming amount of literature every week. So what we do is we summarise that for them, and it saves them time, and we appraise it for them so they don't have to do that.
We work to produce systematic reviews, and they're basically a comprehensive summary of the best available research evidence for a particular research question. So it might be looking to see how effective fluoride varnishes are for preventing caries in children's back molars, their back teeth. And what we'll do is we'll look at all the available evidence, research evidence from across the world, and pull it together so that clinicians have this one piece of information that they can then use to inform their practice.
We have a large series of reviews on dental implants, looking at different types of implant, different methods, surgical techniques. The sealant review is regularly updated because that's one of our most important reviews, and that shows very clearly that sealants work. Our most highly accessed review is for preventing mucositis or ulcers in patients who are receiving treatment for cancer.
And we've used the reviews in this area to develop national guidelines, working with some of the professional bodies within the UK, and we've actually managed to change clinical practice with regard to what treatments are used to prevent mucositis. We recognise the importance of getting the results of our systematic reviews into guidelines. It's clinical guidelines that the stakeholders, the policy makers, the clinicians, those are the documents that they'll be reading to inform their practice.
A recent example was the fluoride varnish review, and there's a guideline group wanting one on pulp therapy at the moment.
One initiative we've taken is to actually set up a guideline repository for international guideline development groups to let us know what guidelines they're working on and what their plan of guideline development will be over the next 2 or 3 years.
At the moment, we have 200 reviews in the library. There are 80 protocols that are in development.
And there are certain search techniques that will help you focus down on if you're looking at reviews for preventing caries, for example, or if you were perhaps interested in dental implants, there's a section on dental implants, and then you can click on the title and it will take you through to the abstract. And then, depending on where you are within the world, you may then be able to link through to the full review article itself.
With every review, we produce a plain language summary which summarises the whole review in 500 words, broken down into nice little sections. It's written in very plain terms, no technical jargon.
The plain language summary is the most important component of the review. We appreciate that that will be the text that is read most, whether it's by clinicians, consumers, and even policymakers.
If I have to use it, I don't know, with my patients or somebody doesn't understand all the terminology, it's like the way they are expressing the information is very useful.
Equally important is establishing the evidence base for products that are widely available in supermarkets and drugstores, from toothpaste, toothbrushes, floss, into dental brushes.
One of the questions that all people want to know is whether they should be paying for a powered toothbrush or a manual toothbrush. And we've done 2 systematic reviews in that area, one looking at powered brushes versus manual, and then one looking at the comparison between different types of powered toothbrushes. And the systematic review that compared powered toothbrushes with manual toothbrushes was only able to demonstrate an effect for what are called rotation oscillation powered toothbrushes. So those are the ones where you've got the round head and it's twisting backwards and forwards. And that was showing a reduction in plaque and gingivitis.
The group has today signed off the publication of a review that is looking at the effectiveness of including an antimicrobial bacterial agent, triclosan, as a copolymer in toothpaste.
It definitely shows that triclosan toothpaste work. It will reduce gingivitis and plaque.
We don't make recommendations. What we do is we say what the evidence says. But the statements in our reviews, it's important that those statements are as correct as we can make them, and that any bias that we have found in the review process is discussed with total transparency so that people do not misuse any statements from the reviews. So I think that's why the methods side of things is so important. It's important that the reviews are as high a quality as we can possibly make them.
People who are undertaking their first Cochrane review are surprised at the complexity of the methods.
We have lots of clinicians who are involved in our systematic reviews, but they need methodological support along the way to make sure that the reviews are conducted to a high standard.
The Global Alliance is the vehicle that we have developed, whereby professional groups from around the world can make a donation. And they're signing up to the idea that priority reviews in oral care have a global benefit.
To participate in the Global Alliance, I think it's important because they need support. Only 50 faculties there, they have been in these workshops, and we have the opportunity also to train people from different parts of the world too, like they are here taking courses at NYU, and then they will have the opportunity to apply this knowledge in the future.
I really want to try and learn how to do and work with the Cochrane group. I believe that they have a very strong systematic analysis.
The systematic review that I'm carrying out, it's to establish the association between periodontal disease and gestational diabetes. So currently we're actually writing it up, and hopefully we'll get it published, and hopefully that will sort of serve as a basis of future policy, and it will also help clinicians address that issue in their clinical practice.
It's great to see the level of enthusiasm towards systematic reviews and how keen people are to learn about them and how they can use them to inform their practice.
That can only benefit consumers and people making the decisions about what healthcare interventions should be provided.
What I hope is that through just a simple global collaboration, we can be ensuring that the best information is available for people to start making informed decisions.